Medicare is a crucial part of retirement planning. Medicare is not a one-size-fits-all, and it is also not a set it and forget it. It is to be reviewed yearly. So with that, let's take a look at 5 of the biggest Medicare mistakes. Hi, I'm Brockway, founder of Boca Retirement Strategies, here to guide you to a successful, stress-free retirement while spending more and avoiding being killed in taxes. Medicare is the federal government's health insurance system for those 65 and up. As a respected fellow professional Benjamin Brandt puts it, when you turn 65, everyone in the country remembers your birthday. You'll be flooded with emails, texts, and calls. You've never seen so much attention in your life. And if you say Medicare out loud 3 times, an insurance agent will show up at your door. Now, Medicare may not be the best option for you. You may be better off with private insurance. Let's look at some of the mistakes. Mistake number 1, thinking Medicare is free or even inexpensive. Generally, Medicare is a cost savings for most people, especially when they are paying for private insurance before age 65. I do have some clients who use insurance through the Affordable Care Act, but income planning is involved. Medicare has parts A, B, C, D, and supplemental or Medigap insurance. Each part has its own costs and some deductibles. Always keep in mind as well that Medicare IRMA brackets increase the cost of Medicare along with increases to your income while on Medicare. Mistake number 2, enrolling in Medicare late. Believe it or not, late enrollment can lead to penalties. So pay attention to the initial enrollment period of a 7-month window around your birthday. If you are employed beyond 65 with workplace insurance, then you will have a special enrollment period when you lose employer insurance. Penalties for Part A will cost you up to 10% of your premium for twice as long as you were late. Part B is an additional 10% for every year you were late for a lifetime. So 2 years equals 20% for life. Part D penalty is 1% of the average premium for each month you were late. So 24 months late is 24%. So while you may think, I'm healthy, I'm gonna hold off on signing up for insurance for a while and save a few dollars, you could very well be costing yourself. Mistake number 3, not signing up for a prescription drug plan, which is Medicare Part D. This mainly piggybacks off of mistake number 2, as you may say, okay, I've enrolled for Medicare, but I don't take prescription drugs, or at least not yet. I'm not getting to a prescription drug plan. Well, if you do ever need prescription drugs, you're going to have to wait for an open enrollment, then sign up, and pay a penalty forever. You could possibly self-fund or get a prescription drug plan through another party other than Medicare, but drug prices are not cheap. Mistake number 4, failing to review your coverage annually. Every September, you will receive notice to review your insurance. Look for any changes in your policy, rates, coverage, deductibles, lists of providers, and drug formularies. I believe websites exist so that you can check your prescription drugs if any generics exist. Talk to your pharmacist, but more often than not, generics are the same ingredients and formulas as the name brand. It's not quite like buying knockoffs, but I certainly am not a medical professional, so ask the appropriate medical professional. Mistake number 5, assuming pre-existing conditions don't matter. So pre-existing conditions really don't matter for your initial enrollment and for a 6-month grace period thereafter. However, beyond those 2 opportunities, medical reviews are fair game. When you sign up, you may be in good health and want a no premium plan and not sign up for supplemental insurance. But if down the road, as you get older and sicker, and you decide you need additional insurance, and a medical review of pre-existing conditions could affect your premiums or worse, your coverage, you may want to jump on that grace window. The short of it, if you want to have the additional insurance in your back pocket and have one less risk to mitigate down the road, take advantage early on. So take action. Number 1, have a plan to implement health insurance and know your options before you need it. Number 2, take note of these mistakes and don't make them yourself. Number 3, subscribe to our YouTube to hear more of our advice. I'm Brockway, founder of Boca Retirement Strategies. If you have any financial questions, feel free to reach out at contact@bocaretirement.com. Enjoy your successful retirement, and thank you for watching. Bye. One last thing, we are also slowly setting up a retirement mastermind group I am calling Retirementality. If you don't know what a mastermind group is, it's a group of like-minded individuals getting together to help each other solve common problems. We plan to run this group in a roundtable format, so peers can help each other. We might talk about things like finance, things like healthcare, things like travel, things like local events. If you are interested in joining this group, you can send me an email at contact@bocaretirement.com. This will be a complete anti-sales group designed purely in helping you help others retire successfully.